Morning, everyone.
Morning.
Good morning. Good morning.
Morning.
Good morning.
Morning.
You know, somebody can keep track. Jane, are you gonna keep track of who's here?
Yeah, and it's recorded too, so
Right,
we'll keep
great.
track.
Good morning. Thank you for being here. I'm going to open the meeting, but then immediately turn it over to Deb Phillips, I think, to help moderate the discussion on the leverage of opioid settlement funds.
Yeah. Thank you. Thank you, Pat. Sorry I'm not there in person, and I had thought Smitty was going to join us, and I apologize if that doesn't happen, but I think we can still have a good conversation. Thank you all for letting me sort of crash your meeting with this agenda, but I'm hoping it's something that has meaning for everyone in the room. And just briefly, for those of you who don't know me, I'm Deb Phillips, and I run the Southern Berkshire Rural Health Network, which is funded by Fairview Hospital, but it's really a collaboration of organizations and any organizations in that serve people in South Berkshire County, with a mission to improve health and well-being in South Berkshire County. So I was really excited when the South Berkshire Public Health Alliance was formed, because it was just another vehicle for opening that communication for figuring out how we can best keep people healthy down here, because we are so different from the rest of the county. So when the funding came through for from the Johnson & Johnson settlement, I think everyone looked at the distribution of funding and wondered how on earth they figured out those formulas, and what that meant for all of our communities. But to me, it really meant that we had an opportunity to look at the way in which this problem has impacted every community in the county, but for us, every community in South Berkshire County, and to really explore whether it made sense to work together and create a comprehensive approach and leverage all of those resources. And in my conversations with Smitty, he was on the same page. And there's also conversation going on, just so everyone knows, about leveraging resources countywide. But even if that happens, I think it's really important that we're clear on what the unique needs are of our South County communities, so that whatever we do, we make sure that the residents of each of your communities get what they need out of this settlement money in the most effective and efficient way possible. I was hoping that Smitty was going to talk to us a little bit more from the state and legislative perspective about the use of these funds. The guidance is coming in slowly and piecemeal about how the funds can be used. And our hope really was that we would lead this rather than responding to their guidance, and really lead it from where we come from. The guidelines for the use are, and I'm just going to read you the principles, are principle 1 is to spend the money to save lives. Principle 2 is use evidence to guide the spending. So there's a lot of research out there. Principle 3 is to invest in youth prevention. Principle 4 is to focus on racial equity. And we all know that that's a really interesting topic in our predominantly white communities, but one that can still guide how we look at those people most impacted by opioid use. And develop a fair and transparent process for deciding where to spend the funding. And I think that that's really where this group comes in, is that we look at how to spend it in a way that's going to benefit our communities. In the absence of Smitty, I don't know if, Jane, you may have more information that you want to share about the funds itself, but then I would like to follow that with Gary Pratt, who is the director, I can't even remember your title, Gary, of
project manager, Deb. I'm here, I'm just off camera.
Director.
Project manager for rural recovery resources. which has just opened a recovery center in Great Barrington to serve all of South County, but is really working to coordinate services to meet the needs of all of our South Berkshire County towns. So I'd like him to talk a little bit about what he's doing. And then what I really want to do is open it to every one of you who's sitting here. And I think that the best way to do that initially is to give everybody an opportunity to speak, just uninterrupted, and then open for discussion of where that leads us. And if you can pass if you don't have anything, if you don't feel like you want to contribute anything at that moment. But I think that it's an opportunity to really look at it with fresh eyes, not with somebody else's, with plans that other people have already made for what to do with the money. So on that note, Jane, is there anything else you would like to add about the funding? Because I know that you've looked at it also.
Yeah, I mean, it ends up being almost $800,000 available over the next 15 years, right? Which sounds like a lot. It actually, like, when you really break it down, it's not so much, especially for some communities. Like I was just telling Ellie, Mount Washington's getting $357 over the next 15 years, which isn't zero.
But I'm always I'm in it for the money. I just want you to know that, always. My primary thing.
So it's just one of those things where, you know, I think being strategic about this could be a sustainability issue, you know, help sustain some efforts. So I don't really have much more to add, except that just the amount of estimated funding. Yeah.
Great. Thanks, Jane. Ananda, did you want to?
I just add to that estimated funding, like if what happens in South County is looking at pooling that funding, then that comes out to an average of 40,000 a year over that period. And then you really, that's, I think, when we start to really see what we could potentially do together with it. So.
Thank you.
40,000 a year per or 5 years? No,
Total
Okay.
for 5 years. Okay.
5 years, right? 15, yeah, 15.
Yeah, and the actual like year to year varies, but for whatever reason. But I just find it was helpful for me to kind of look at the math that way and then say, oh, if we look at all of South County, yes, you could actually do something with that. As opposed to like, what are you going to do with $300 over 15 years?
You have no idea how good we are.
So I'm gonna move to
I have faith, but I'll let Gary jump in.
It's a weird, I have a laptop, so I'm trying to capture everyone, but it's impossible to do that. So I'll just kind of do this while you speak and then I'll move it again.
Great.
Okay. So get captured on the camera.
You're on, Gary.
So for those who don't know me, my name is Gary Pratt. I'm the project manager for rural recovery. And as was already stated, on April 1st, we opened the South County Recovery Center at 67 State Road in Great Barrington. It is a peer support recovery center that we got a grant from the Health Resources and Services Administration of the federal government on September 1st of 2020. And it's a broad ranging grant where we have multiple funded partners who are the Railroad Street Youth Project, who also operates as the fiscal agent, the Breen Center, Fairview Hospital, Berkshire Community College. Now you all, the Southern Berkshire Public Health Collaborative, we brought you in, and the Rural Health Network as well. So we're well represented here. And so what we've done is, you know, in working with Fairview and Breen, really trying to implement substance use screening as universally as possible in primary care settings and other settings. And in so doing, we've worked with Berkshire Community College and Breen to come up with curriculum to teach providers how to screen properly, and to, more importantly, implement things like motivational interviewing so people can feel more confident in initiating those screenings and asking questions that can lead to a more robust conversation and comfort level where people can feel confident in actually reporting their substance use in an honest fashion, which can lead to a positive screen, which therefore can lead to a referral to services. And one of the barriers that we've identified over the past few years is that screening wasn't happening universally because the providers were running into barriers where, you know, they would get a positive screen and then they don't have anywhere to send somebody. You know, not everybody requires a detox. Not everybody requires residential treatment. Like some people just need some support, and that's where we come in now. Rural Recovery Resources, we act as a referral hub. And, you know, through working with the South County Opioid Working Group and multiple other agencies, we've been developing these warm handoffs for years now, where, like, you know, I'm still a licensed alcohol and drug counselor. I'm still per diem counselor at the CSS in Pittsfield. So, like, I have those connections at McGee and CSS where I can call a person that I know there and, you know, pull the proverbial strings to get a person into treatment quicker. And, you know, we have those kinds of relationships that are built up within the community where, you know, I can call you, Amy, directly, and I know you, and like I could say, I have this person here. What kind of services can you provide to this person? Instead of me just saying, hey, why don't you call the South Berkshire Public Health Collaborative and see what they can do for you? Or hand somebody a pamphlet and say, there you go, you're all good now, make a call. You know, we really work on these warm handoffs. So, and you know, there's so much to the grant work underneath that I could literally take like 2 hours to explain it to you all. But, you know, in the grant work as well, there was language to create a safe space for people who use substances. We all knew in writing this grant that meant opening a recovery center. And that's exactly what we've done. So, you know, it's been a year now that we acquired the space. It was an extensive renovation. And it's up and running now. We're going to have a grand opening on June 11th where we'll present it to the public. And, you know, we're really trying to ramp up programming before then, having our furniture trickle in. So, but it's a beautiful renovated space. And again, this HRSA grant is for the rural area of South County. It represents 14 towns. And while we opened the recovery center in Great Barrington, it is not specifically for Great Barrington. The services that we provide are not specifically for Great Barrington. We do community outreach stuff. We have 2 full-time recovery coaches. One is funded by HRSA. The other one's funded by the town of Great Barrington right now through the community impact funding. And like, we will provide services to anybody in South County. And, you know, that's a pretty wide geographic area. So we also provide naloxone trainings, and it's, you know, we've scheduled a monthly naloxone training for the recovery center. It's on the last Friday of the month at 5 p.m. to 6 p.m. But we also do community outreach naloxone trainings where a person can call us and we will go to them and train them. Like, we'll teach them the signs and symptoms of overdose. We will provide them with 2 doses of naloxone, and they'll be better prepared to respond if that kind of emergency happens. And yeah, so far, like, I think we've distributed around 50 or 60 doses of naloxone just in the South County area. A few months ago, I trained somebody in the Price Chopper parking lot because they were on their lunch break, and, you know, they were like, can you meet me here? I was like, absolutely, we'll meet you there and we'll get you what you need. So, you know, this South County Recovery Center, like I said, is for all of South County. We're trying to bring people in, and you are probably well aware of the barriers that still exist with transportation here, with just being in a rural community anyway. So, you know, with the South County Recovery Center, we're trying to bring everybody in and really find out what the community needs. And, you know, we're hoping to keep it around for as long as we possibly can. And like, one of the things that, you know, kind of came into my mind too, like with this Johnson & Johnson funding, like this, like this is the way I look at it, right? I'm a person that has survived the opioid epidemic. Luckily, I don't know how I did it, but I did it, you know, through a lot of help of other people. Like, I don't use the word victim. I don't feel like I'm a victim, but like in the settlement, right, it talks about victims of the opioid crisis. We're all victims of it. I have personal lived experience, but I'm sure everybody sitting at this table has some form of personal lived experience, because we all know somebody that's been affected by it. We've all either experienced it personally, we've lost somebody, we've watched somebody struggle, and it's happened all over South Berkshire County. So, you know, with what we're doing at the South County Recovery Center, you know, we're renting the space, and our rent would easily be covered by, like, if we pooled these resources, it would easily cover the rent and the utilities and probably some kind of like food to like get people in the door and to help provide services for a very long time. What is this, 15 or 16 years or something like that? You know, it could assure that that space could be open for that long. And like with that amount of time, we could, like, I don't want to say could, we will build a robust recovery community where people can come and feel welcomed and like they belong, and they finally have a place where they can reach out and find the help that they need. And it's been greatly lacking in South County forever. Like I said, like, I'm a person in long-term recovery. Basically the entire scope of my using history was right here in this town. When I got into recovery, I had to leave the area. I had to leave the area to seek the help that I needed. And I was, you know, I'm grateful to be able to return to the area, and I'm grateful to see a lot of changes and a lot of progress, but there's still a lot more progress to be done. And what we're doing at the Recovery Center is truly embracing all pathways to recovery. Like, we will truly meet people where they're at, wherever they are on that spectrum of substance use. Like, whether they're still using, we can have harm reduction conversations. We can refer them to harm reduction places. We have Berkshire Harm Reduction coming once a month with their mobile unit parked right in front of the Recovery Center on 67 State Road. It's the last Monday of the month from 11 till 1 p.m. They're there. And, you know, that's a full spectrum syringe access and wound care and sharps disposal, Narcan training, sexual health and wellness. They do all of that stuff. And, you know, that's one of the services that we're able to provide. But like, we truly meet people where they're at. So like, people that are, you know, on the 12-step path, we welcome them into the space. If a person wants to set up a community-based mutual aid group like Alcoholics Anonymous or Narcotics Anonymous, it's a place where they can do that. We have a recovery Dharma group just started up on Saturday mornings from I think it's 10 a.m. to 11 a.m. That's a Buddhist approach where people come together. They talk about the book, Recovery Dharma. They do a meditation and they connect on that level. And, you know, those are the kinds of things that we're offering. And it truly meets people where they're at every single day. And, you know, one of the things I've been saying, I changed the Wi-Fi password to it. It's no wrong door. There is no wrong door to recovery. Like, I personally believe if you walk through the door of a recovery center, of a recovery meeting, of a detox, you're doing the right thing. You're actively trying to improve your life. And, you know, one of the things that's guided me over the past 5 years is the SAMHSA working definition of recovery, is the Substance Abuse and Mental Health Services Administration. They have a working definition of recovery, which is it's a process of change where a person improves their health and wellness, lives a self-directed life, and strives to reach their full potential. It doesn't talk anything about using substances. It doesn't talk about going to meetings. It doesn't talk about any of that stuff. It's about improving your life and truly, you know, meeting people where they're at. So, you know, it's a huge thing for South County to be able to open something like this. It's a novel idea, and it's already paying dividends. Our 2 recovery coaches have been working with, I think it's around 25 or 30 people. Like, you know, not everybody is fully ensconced in the recovery coach model, but we reach out to people on a daily basis and do outreaches and keep them connected. So when that time comes, when that window opens for a person to take the next step, we're there to help them through that window, because that window closes very, very, very quickly, you know. So, you know, it's where we come in, and like, building this recovery community, people can feel like they belong and, you know, truly find the help that they need. And I'm just grateful that we're able to do this kind of thing. And, you know, there's been so many people behind the scenes that have helped build what we've built. And, you know, I've been saying it for 1.5 years, what we're gonna do, we're not gonna do it anymore. We are doing it. And it's truly remarkable in South County. Yeah, I think that's about all I have to say. So thanks.
Gary, that's very impressive.
Thank you. Thank you.
That was really helpful. I would love to now just go around one by one, and I'll pick on you, Martin, because you already put a comment in the chat. And what I would love to hear from everyone in whatever way you want to talk about it is what you see in your community either happening, what you see as things you might like to see happening in your community, and what your thoughts are on whether you feel that collaboration will get us farther than working separately. So in whatever way you want to address that, what I'll do is sort of go around the Board of Health people who I see on the screen, and then I'll ask Pat or Janie to go around who's at the table there, because I can't see that. How does that sound?
You want to start on who remote in first?
Yeah.
Martin,
Yeah.
you want to go ahead?
Sure. Thanks, Deb. To me, again, I put the chat in there. It's, we need the way that we need to come up with ways to leverage the 800,000 through our collaboration. I think the collaboration is the only way and the best way for us to work together and try to address these issues. I personally believe, at least in Sheffield, that this is an issue that is not talked about. It's not, stop the stigma. I see the signs out in various places, and I think that's a big nut to crack with regard to our community embracing the need and the benefits of a rural recovery program. So I don't know how to go about doing that. It's almost an afterthought, at least in some respects at the senior level in terms of Sheffield's management. Great, we're getting opioid funds, super. And I think I've told Pat this before, and maybe Jim as well, and Janie. Well, that's great. We've got all these extra funds. Can we now repave Kellogg Road? Are you kidding me? You think we're not going to use this for the purposes of rural recovery? Forget it. Forget repaving Kellogg Avenue or Kellogg Road. So we need to raise awareness as we go forward and make this more of a community conversation beyond the group that's here and doing what we can do to educate people that there's nothing wrong with people that use drugs or abuse drugs. They're part of our community, and we have to work with them and reach out to them and help them help themselves. So that's all I wanted to say.
Thanks, Martin. Absolutely. And one of the things that I also did want to say is that this is the first step, and we are here to support bringing this into awareness and to the people who make fiscal decisions in your communities in whatever way you want us to be engaged in that. So Juliet, how about you next? I'm just sort of going the way I'm seeing people on the screen.
Hold on one second.
Sure.
I just want to thank you all for this opportunity to be a part of this very important discussion. Hi. Certainly I believe that a collaboration is a prudent way to proceed. Small towns are stronger together when we work together. How we'll do that and the details, it's all in the details. But Egremont is a strong believer in we're stronger together when we join together. So I will leave it to others to work out those important details, but here to assist in any way that I can.
Thanks, Juliet. Brandy?
Good morning. I agree. I believe we should pool our allotments. Is there a process for this, Jim, that do we have to have a select board vote?
I don't know the answer to that yet, Brandy. I think the initial idea is to bring us together to have a conversation. I think, like Jane and I were kind of talking what that would look like. And I don't know the answer to that, but
Okay.
obviously we would need to get some type of select board approval. mean, I guess in my mind, from a process perspective, is to continue to have this conversation over the next couple months. And maybe, because you don't want to present to a Sheffield Select Board, and ask without being specific on what the funds will be used for.
Well, and how it's gonna be administered. I think we may end up with a subcommittee on trying to
Exactly.
define this and
Yeah,
then bring it back.
great idea.
Working with Jeff.
Okay.
Yeah.
Yeah, that's a great idea. And if, just so, the more ideas we get out on the table today, that will give the subcommittee something to work with.
I mean, we have the infrastructure as a fiscal host to bill and receive and reallocate dollars. We do that on a daily basis, through the collaborative and other mechanisms that Tri-Town has. I don't know what the answer is, or, Sheffield wanted, they were committed to give their annual allocation to Gary's group. They could do it directly too, right? It's just, you don't need to have a third party. To me, it's like, what I care about, and I don't know what Lee's thinking, or Lennox or Stockbridge, but part of my responsibility is to engage my leadership. But I think before we start to really dive deep into that,
We have a lot of work.
we gotta have a little bit of a plan on, a plan of attack. What are the funds? What do they look like on an annual basis? What's the breakdown by town? Here are some ideas, and here's what we're presenting for a specific ask.
Okay.
Right. And so I think there's a lot to go, I think. But in my mind, it's like, I don't want a town, even though I can't control that. Like, I wouldn't want Lee to buy a bunch of Narcan supplies and put them in the storage closet. Like, we
Exactly.
need to really use the funds.
Right.
Right.
Go ahead, Jeff, going around.
Hank from Dr. Schwerner, do you have anything with respect
Well,
to Stockbridge?
I think the collaborative is a great idea. I certainly think we need to raise awareness in Stockbridge. We are part of Tri-Town with you, Jim, as our leader, and would like to work with Tri-Town and this collaborative, get much information and then certainly services out as needed.
So I am gonna, thanks, Dr. Schwerner, I am gonna just ask if there's anything you're seeing in your communities or any ideas you have. I love the fact that everyone is interested in collaboration, and that's important to know. But if there's anything else about your community you would like to offer, and I don't know if you were done, Brandy, after your question.
Yes, I was.
Anything else, Dr. Schwerner, or else I'll move on to Kay, I guess. I'm just
Nothing
reading
here.
names on the.
Nothing here.
Okay, thanks. Okay.
I'm on. I'm Kate Purcell. I live in Monterey, been volunteering been very active with the Council on Aging. That's how the name James Willits is very familiar to me, especially since vaccination. I'm pleasantly surprised, really, that you're onto the opioid piece. I do have grandkids around, and they report it's serious, Grandma. And I'm familiar with some of the programs that have addressed that. So for today, all I'm thinking right now is, I'm so glad. I've been getting this notice for a few months and have always been too busy to see what it was about. I'm familiar with Tri-Town and the public health piece, but familiar is not really knowing what you're up to. I'm very interested. I will continue to see what I can find out about what's going on. And the thought of, I have no problem speaking to the select board in Monterey, but they're getting a lot of noise right now. But I think there would be an interest, and often it's the Council on Aging is the one that's pushing this, that and the Board of Health. So I'm keeping my ears open, and maybe I'm going to keep my mouth shut for a little while. But thanks for doing this.
And Kay, this is Jim. Also, too, the Board of Health in Monterey actually approved a couple months the harm reduction ban program. And I think we're just fine. I think they're trying to finalize the paperwork on that, but they approved that. And I think most of South County has approved that process. So I think we're making small incremental steps. So thanks for coming.
You're very welcome. Thank you.
Thank you. Diane? You're muted.
Can you hear me now?
Yes.
I live off the bypass, so I try to keep muted as much as possible, or you hear the trucks going by. Morning, everybody. I'll be redundant and say, yes, this is a wonderful program. Yes, I'm sure Lennox Board of Health along with Tri-Town would want to help as much as possible. What do I see in our town? Well, Lennox is a town that never talks about it. I don't know if it's like that in other towns, but I've had 3 children go through the system, 2 grandchildren go through the system. And unless you sit and talk to your neighbor, you never know what's going on in Lennox about this problem. And I know it's there. And it bothers me very, very much that I don't want to say I feel like Lennox has swept it under the carpet, but it's not a topic that anybody wants to talk about. Even if you go down and talk to people sometimes, it's something they care to defer. So this is, in my estimate, a very, very important program to put out there. So maybe people can't ignore it anymore and grow to realize we need to accept and talk about it. And that's all I've got to say.
And Diane, I did communicate with Mary Beth Mitz, who's the chair of the
Mhm.
board, and I thought she was going to come, but I think she's away. So
She's in California.
she's
Yeah.
aware of the concept of a regional collaboration, if it makes
Yep.
sense. So anyone else on the?
There's no one else. No, we pass it around the table now.
So
Jim,
we'll,
you're on.
we'll just go this way, I guess.
Okay.
I'm
Does
sure.
Gary get another turn or is it on me? So this is something that I've been involved with since, oh gosh, I guess it's been about 2015. And from the public health perspective, I've seen kind of the evolution in South County. And I feel like we've done our best in small groups in South County to try to like address the small things. There was a that's not small, but like, working with prescribers, getting the police to think about carrying the lock zone, and all of those things have started to happen. But I think that the biggest thing that's happened really has been this recovery center. And the reason why I say that is because one of the recurring things that we have seen throughout, both through it's the South County Opioid Working Group, which used to be called the Fairview Great Barrington Opioid Working Group, and then there was a group that was meeting. I don't know if anyone remembers that there was a group meeting in Stockbridge, and the reoccurring theme was that there's not enough continuity. People are getting lost. Even if they were able to get a referral, if they didn't show up or didn't meet certain expectations, after 2 times they would get dumped off, and then they would be again in a free fall. There was conversation about, when there's an immediate need, and there wasn't people to help walk families and individuals who had that window, that very short window open. And I feel like from both someone who cares about this issue and also from a public health issue, I've been on housing calls where the person is in immediate need of support and like someone to help them guide through the next steps, especially since there's a lot of co-occurring situations. And so just having someone to call, I think is a huge thing. And having someone, having an organization to call that is person focused and not necessarily like process focused, I think will help meet people where they're at. So I couldn't be happier that the recovery center is open. And I feel like this might be an opportunity to help with that sustainability piece. As we know, like grants come and go, right? I think the HRSA grant right now is like good for another 2 years. And then, maybe there's another grant, but this would help like just be part of that sustainability plan. And that's the thing that really excites me.
Yeah, thank you, Jenny. Ellie?
Well, I think Mount Washington has to join the what seems to be a large group of towns that don't talk about these situations. It's not that Mount Washington has not been impacted. We've lost a few people to substance abuse, whether it's particularly opioid or not. But it is something that people just, you're absolutely right, people just don't want to talk about it. So I certainly think collaboration is the way to go. I mean, we're good with money, but dang. $350 over 15 years is gonna be tough even for us. But more importantly, I think having the center open, you're right, Jane, having a place to call for those of us who don't have a whole lot of staff support, whatever. That is critical. How we move forward with the town is going to be very difficult. Our town right now, after our annual meeting, is in shambles. I'm going to be very honest about it. It was a meeting that had I had children, I would have taken them out. And that to me is really, really, really upsetting. So I can't even imagine where we're going to be bringing this up. And we will, because it is something that is truthfully got to come out. We've got to talk about it. I throw my side in with the collaborative. I think we have to be very clear, and it gets into that really difficult situation between select boards and boards of health. And understanding, that boards of health can advise, but we don't hold the purse strings. And we're going to have to, I know in our town, we're going to have to work hard to combat some very, not on the part of the select board, but on the part of constituents who do not want to see anything going on, and they don't want to spend any money on anything. And we can all just pull ourselves up by our bootstraps and carry on. So where that goes, I'm glad it's not another year before the next annual meeting, because boy, I'm telling you, I gotta have a vacation or something. It was intense.
Thank you,
But
Ellie.
thank you.
Thanks, Ellie.
Hi, I'm Amy Hart. So as a local resident, and I've lived in 3 of the towns in this community, definitely the silence is an issue. Another issue that I have been thinking about for a while, as a member of sort of the associated recovery community, there's no resource for youth. There's no Alateen. It's been many years since there's been anything like that in the area. And I would see that as a priority to try to get something going for supporting family members impacted. Second thing, as a nurse, I have been in the position of responding to 2 crises involving opioid use. And in both times, I found my training to be inadequate, and I was relying on instinct to identify and recognize the situation. One was a chronic use, one was an actual acute emergency. And this was in a congregate care setting in our area, the focus on mental health issues. So what I recognize is that a gap perhaps for training for responders who may be in that position, but not sort of see that as an everyday occurrence. So that might be something that the organization could help with. I'd love to see some funds go toward that. Third thing, as a public health nurse, I'm always looking at root causes and prevention, upstream versus downstream responses, because otherwise you're just sticking your finger in a dam. However, I didn't realize the amount of funds being what they are. And I think the amount of money we're looking at, we do as a community need to address housing, transportation, lack of mental health resources. All of that is there. Those are all prevention and root cause things we need to deal with. However, I think with this amount of money, it makes more sense to do a really good plug in the dam. And I guess I just want to support that idea. Also, I was wondering how long that HRSA grant would last for. And so 2 more years isn't much. So I think it's a good idea to support the project. I guess my only concern might be, I don't know the parameters of the grant that you currently have, and whether, if you expect it to be extended, whether it would render you ineligible for certain funds that you're currently able to get. So I just would want to have some sort of caution.
Were it to be extended, it would not.
Great.
Yeah. I did just want to mention that beginning this year, Railroad Street East Project does offer counseling specific to young folks experiencing issues around substance use, using the invitation to change model, and also to parents.
Great, great. Thanks.
Rebecca?
Okay, so at this point in everybody's turn, a lot has already been said, and I, agree with most of what's been said, and it's reflected in Great Barrington too. But as Gary said, the Recovery Center as well as the Harm Reduction Center, they were funded for all of South County, even though the hub is located in Great Barrington. So that's kind of how I think of these funds too. It's, they have to extend for the benefit of all of South County. So I guess I just have some questions about the process, which I don't know that we know yet. But it seems as though, like Ally said, the purse strings are with the select board and the finance committee. So I don't really know what our role could be as boards of health or even as a collaborative in ultimately determining how this money is spent. But I'd like to try, if that means forming a subcommittee to recommend that, this money goes to the Rural Recovery Center or whatever, the harm reduction facility. Because there's lots of programming potential for both places that I think could really benefit. We mentioned transportation, maybe having like a what is that called? Like a lift or like a ride share, at the recovery center, or grief counseling at the recovery center. Just I think there's this funding could, yes, pay the bills, but then also bolster the programming that's there.
Thank you, Rebecca.
There's very little to add. I just would like to say that I think in Sheffield and elsewhere, it's not a non-issue. It's just an issue that people don't know how to talk about, don't know what to do about, and thereby don't take it up. That's my view. I mean, because the harm reduction ban was very quickly endorsed by our police and fire. We had no problem with that. So I think they're aware, they just don't know how to solve it. And somebody presents them with a solution, or at least a constructive approach, such as the recovery center. I think we're not going to have as much trouble. I think it's going to take some guilt off people. I think it's going to give them a way of productively addressing this. So I'm on one hand conflicted about, let's just tell them how to solve this problem, quote unquote, rather than force them to talk about it. Because I don't think we can force them to talk about it.
Totally well said.
Yeah,
Totally
so
well said.
that's sort of my thinking on it, but I'm excited by this conversation, and I think we're all pretty much in on it.
Yeah, and I think I'm not gonna repeat all the high level points. I think from a process perspective, I would probably, maybe put a motion on the floor as a collaborative to maybe get a less than 5 collaborative members, because that'd be less than the quorum, and maybe some outside collaborative folks to throw together a quick subcommittee and maybe hammer out some ideas and thoughts and bring it to the next meeting. I don't want to delay the process, because I think the sooner we can kind of solidify. And I look at the collaborative, at least at this point, and this is only me speaking, as advocacy in bringing people together, the right people, have some ideas, pull Gary in, and start to formulate what an ask could look like, and then maybe solidify that, and then we just present it. We give it to our respective boards in groups, go back to your towns, and have that conversation. And just, I do agree. I mean, I think some towns don't know what to do with it, but if we presented a pretty solid ask and advocate for that, I think that could be the initial role of the collaborative and its membership, and then figure out the administration. Then if it works, we can figure out how to.
No, I
deal with
think
that
we
later,
need
right?
to work out how it works.
Oh, sure, you
because
can do
I
that too, yeah,
see our
yeah.
select board saying,
Sure.
well, what do you mean? How
Sure,
are we going
yeah.
to monitor those funds?
So I think we should put a small group together, and then that's actionable for today.
Right.
And then take the next step.
I would be
Can
happy.
can I do one, can I ask one thing? I skipped over Jill because I was so focused on Board of Health next.
Oh, go ahead,
members,
Jill.
and I just wanted to make sure Jill had an opportunity to speak.
I agree with everything. There's a major issue with drugs and alcohol at the middle and the high school level that I know, my kids are on social media and they tell me all the time, oh, so-and-so's, posting, drinking and smoking and doing whatever. So there's definitely, that piece that needs to be addressed at some point also, because it's not talked about. It's kind of like, it just turned an eye at the high school level, which is sad.
Yeah, I just want to interject quickly and maybe offer some hope to that silence part of it, that I don't feel like Great Barrington was there so long ago. I mean, I think the conversations are happening in Great Barrington and there is more awareness and the stigma is slowly shrinking. And I don't think we were where Mount Washington, where Sheffield was that long ago. So I think there's hope to bring people up to a better understanding of these issues and the severity of them in their community.
If I could just tack onto that too, like over the past year, since we got this grant, I've been participating in the South Berkshire, what is it, the Health Coalition? Yeah, the one
Community Health Coalition.
Community Health Coalition. So like I've been going to Mount Everett and Monument like monthly, and I went to Monument Mountain. I couldn't even fathom like something like that happening when I was there in the 90s, and like I was standing next to young people last month figuring out how to bolster intergenerational connection, like, and how to like make youth more comfortable in having those conversations with authority figures and people in power and adults, and like to feel that comfort level of saying, yeah, I have been vaping and I need to get some help with this. So there are efforts being made, and it starts with prevention and follows right through to treatment and to recovery. And it's a paradigm shift in thinking, like getting beyond like you're either sober or drinking, or you're using, or you're clean or dirty, or it's this spectrum, and like truly meeting people where they're at it's instrumental. And when we talk about young people, that's a whole other thing. How do you reach young people if you don't ask young people how to reach them, and give them that inclusion and that belonging? So I have to credit with the Health Coalition with that, because it's pretty amazing. Yeah.
Thank you.
Just for folks who might not be familiar, the South County Community Health Coalition is made up of members of and serves the towns of the two southernmost school districts, and is a version of other previous coalitions doing primary prevention work around teen substance use. We're in a assessment and strategic planning phase after 7 years of walking through a strategic plan. And I'm, like you were saying, Rebecca, there is hope. We've, in our communities, been successfully able to prevent an increase in cannabis use with legalization of recreational use, and in fact have seen a decline when that is not what's happening at the national level. You are right, Jill, alcohol is a huge issue. And I know that's very much in the conversation as the assessment and planning is happening. And it does use an intergenerational model with youth from both school districts, part of the assessment and planning process with partners from various towns and organizations.
Lily.
Pat, I'd like to just hijack for a second. I'd like to make a motion for this committee I don't know exactly how to phrase it, but to invite members to have a subcommittee to come up with exactly what you were talking about, Jim. This is the worst motion in the world. Are you still?
Yeah, no, make a motion for the collaborative to create a subcommittee to develop
Thank you.
an action
Boy,
plan to
it's nice to
present
have a brain. Thank
to
you.
membership towns.
Yes, please, because.
I'll second that, whatever that sounds like for Jade.
Keep writing, Jane. I'll
I
try.
record, I do listen to the recording after.
So, what we have to do a roll call vote. I forget, we have Zoom
Right,
options.
we have
We
to
have to do a roll call vote,
right.
so.
All right, is there any more discussion of that motion? All right,
Can you? repeat the question a little
Okay.
bit?
So Ellie's motion would, I'm not
Go right
hijacking you
ahead,
now.
go right
The
ahead.
motion would be for the collaborative to establish a subcommittee for the purpose of working with other organizations to present to create an action plan for final presentation to membership towns.
I second that.
thank you. All right, further discussion, hearing none, let's vote.
Alford,
Okay,
yep.
Now Washington, yes.
Sheffield, yes.
Lee, yes.
Stockbridge, yes.
Otis, yes.
I don't know who it is, Tom.
Diane?
Lennox, yes.
I think that's,
Great,
yeah, I think Brandy already voted, so that's that.
terrific.
So I'll make, so what we can sort out now is who would volunteer, who would be on that group. We should probably
Right.
sort that out today.
Yeah, but I'd like to close this part of the meeting and get to that. Deb, did you have anything more? Are you?
No, thank you. This was exactly what I had hoped that we could accomplish today. I really appreciate the interest and the energy and the time, and would be happy to work with your subcommittee on putting together some kind of plan. So in whatever way I can be of assistance, I'd like to be part of it.
Thank you, Deb.
Thank you very much. All
Thank
right.
you very much, and I'll head out and you can continue with your business. Thanks a lot.
Thanks, Gary.
Thank you all.
Appreciate
Glad
it.
to see you.
Thank
Appreciate you
Gary, I
having me.
need to have some contact information from you because I already have jobs for you.
Yeah, I
Oh.
totally forgot cards.
Okay,
I think Jane can hook you
I
up.
think
Okay.
you will.
And check out our website, rural-recovery.org. All the information's on there as well.
Okay.
So, yeah.
And if you have more cardboard, just let me know.
Okay.
Right. And
cardboard?
Lots of boxes.
Thank you all.
Have a good one.
Jay, would you be sure that that's in the minutes, his contact information and the website as well?
because I think we need to have another NARCAN training and bring camp. Yeah. And our youth people in.
Yeah, yeah.
Because I think this is one of the ways we're gonna get people to.
It was easier for you.
Okay, we're going to pick up the agenda on item number 2, and we'll get back to forming the subcommittee at the end. There were minutes to be reviewed and approved from our last meeting, April 8th.
I make a motion, we approve the minutes of April 8th as written. I didn't find anything different.
Good, thank you. Second to that?
I'll second.
All right, moved and seconded to approve the minutes. Any discussion on that item? All right, all those, do we have to do roll call?
Yeah,
for
you
this?
just go around and say yes.
Aye.
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 Thank you very much. Public health nursing updates.
I think I just wanted to make sure the group knew that we still have plenty of KN95 masks to distribute, and we are continuing to drop them off all over the county. Also, another thing, schools are, of course, grappling with the increase of cases, and with funds from the collaboration we have with the Rural Health Network, we can purchase youth or child-sized KN95 masks. For example, one way this is happening is the Southern Berkshire food distribution that happens weekly. Next week, we'll be distributing a month's supply of child and adult masks in each package that goes home to families. So, and that's with Southern Berkshire District, but we can do that with other districts too. So get in touch with me if you're interested in that. And I'll be reaching out to the schools as well, but everybody has their connections and people they know. And other things, other organizations too might be interested. Things like churches, maybe, I don't know. I mean, this is for the community, and they were free that we got from DPH and MEMA. So we really want to put these things out there and put them in people's hands, get people to wear them. And so I guess on that topic, I wanted to give a little update about where COVID is. The state dropped its data last night, as well as the CDC. Really things are rocketing up. I just want to emphasize that. More than we expected this spring to happen.
We're still
And
red, right?
we are very much still in
Yeah,
the red. And
okay.
in fact, I didn't have a chance to run all of our South County town numbers, but for Great Barrington in particular, usually what I do is I look at Great Barrington and Pittsfield first and the county overall. So for example, what the state has for PCR tests positives last week in Great Barrington was again more than double the previous week. And I think also important, the positive test rate went from 5% 2 weeks ago to 10% last week. So a doubling of that. That number itself is less meaningful because now only people with symptoms are covered under insurance for a PCR test, but it's still worth paying attention to. We haven't seen this kind of number before. At this point, with the increase we're seeing in Pittsfield and over the county, frankly, South County is where things are as hot as they are anywhere in the county right now. And I don't know much about the why, other than maybe visitors and traveling and folks coming back from Florida from having been there all winter. I don't know, but we really hear this is the hub for COVID cases right now, increasing. CDC similarly has us really up, and I wanted to highlight our positive admissions to the Berkshire health system have also increased over the past week quite a bit. So, you know, how much of that is with COVID versus for COVID, right? I don't have that information. I'll be asking today at the VCBOHA meeting if anyone has any information. To our knowledge, as Jill and I talk with community members, and we're still calling anyone 65 and up, anyone 18 and under, we are not hearing of severe symptoms. And the profile of the current strains of the virus, obviously, you know, we all know it's more upper respiratory than lower respiratory. So we're not seeing sort of the lung involvement that was bringing people to the hospital before, the breathing issues. We are seeing we're seeing fever. So think about elderly fevers, dehydration, fatigue, weakness, falls, this kind of thing could be bringing someone to a hospital setting. So, you know, I do recommend mask wearing. This is not what the state is saying for vaccinated people. This isn't even necessarily what the CDC is saying for vaccinated people, but I do want to highlight the importance. If we're gonna, I'm getting a lot of calls from organizations that are trying to figure out what to do with their staffing. I mean, I got a call just this morning from a congregate care setting that is like, how are we going to get through the weekend? So many people are out. And I think this is just something to keep in mind that you bring back to your communities. You know, how do we keep functioning while the state is still requiring people to isolate or quarantine with COVID? And I don't know if that will continue indefinitely. I don't know if at some point the state just says, all right, you know, you win COVID. I don't know what's going to happen, but this is real right now. So the other group I'm thinking about are also, just so you know, retail workers and, you know, essential personnel. So, you know, I'm thinking about maybe I'm dropping masks off to places like car hardware or, you know, the pharmacies or grocery stores. Like, how do we protect our workers? This is a huge thing, and we don't really have the channels to just sort of call each business up and say, hey, would you be interested?
The Chamber of Commerce does.
Yeah, maybe there's a way to do this in a more organized fashion. I will look to others for help with that.
Yeah.
But this isn't going to go away quickly. I think is the other thing. We have the BioBot data, which usually gives us a 2-week projection. So it increased by a third. This is the May 4th reading is the most recent. It increased by a third over that previous week. So here we are a week later, we're going to see another high week, and then I don't know what will happen right now. We're waiting for the next batch of data. So
I have a question, and I want to put this out to everybody. One of the things that I'm finding very disturbing is the dismissal of the side effects. Everybody I talk to says, oh, it was a bad cold. Okay. I'm telling you from personal experience, this is not just a bad cold. And what I'm seeing from the side effects and the after effects are serious health issues. And I think that both the state and the federal government, they don't want to talk about this. How do we get this across in the communities without sounding like we're a well, I'm used to being called a crazy person, so that's okay. But it's very disturbing to me to sit there and listen to doctors tell me it's not a big deal. And yet I talked to a renal specialist who said this is a very big deal. You are talking about elevating people's kidney disease by a full classification because of COVID.
Yeah.
That's really scary because most people over 65 are beginning to limit their kidney function to begin with. You don't want to go from stage 2 to stage 3 in 3 weeks. But how do we do that?
Yeah, you're right. We have far increased risk of diabetes among children, type 1 and 2. And then we're not even talking about long-term COVID, which is another workforce issue
Yes.
that I don't think is being really talked about. Reducing transmission is so beneficial for so many reasons. And we are sort of spitting into the wind when we're getting different messages from the health world and from the state, from even the country. It's very hard. Locally, we can respond to our local situations. So I guess that's what I'm encouraging.
Well, even our
folks
local
to do.
doctors are not.
Yeah. Yeah.
Even our local doctors are not confronting.
Rebecca, did you have you have a hand up?
Yes, I have 2 questions for Amy. The Board of Health meeting last night and Dr. Chang really sang your praises. So thank you for the emails. She reads them. I mean, all board members do, but she really appreciates them and she wants to tell you that. So that being said, she asked if your emails, in addition to your dashboards, which I can easily put on the website, but she had wondered if your emails could be posted in PDF form on our website as a good resource so people know what's going on in the community and they can look to your suggestions, which I agree with her, but she said are very helpful.
Yeah.
So you can think about that. You don't have to answer right away, but wanted to ask you before.
I think it's kind of a bigger question about the role of the collaborative and sort of, it's tricky, right?
So I have some ideas on that real quick.
Okay. Can
Yeah,
I
but
ask
no,
both
but
of
yeah,
my
absolutely, yeah,
questions? We didn't finish our conversation about the antigen tests. So while you're here, both of you, if you'd like to go downstairs before you leave and take a couple boxes. So as you're circulating the masks, you can leave the antigen test. I still think I need to get Parks approval for the gazebo to set up the COVID testing clinics if we want to do that. But I'd like to do that now since we're kind of in the midst of when people would like tests.
Jill, have you gotten anybody, and I don't know if the word is really truly out, but have you gotten anybody who's asked for a rapid test with you?
I have not,
So
not
far?
at this point.
And do we have it out there that, like,
So,
is it
yeah.
on town websites?
Yeah,
So people know?
I'll add that to my ideas to
I also
Rebecca
have
when she's
one-
all done,
And
yeah.
then my last question, which also came up last night at our board meeting, is how to report antigen tests. So I had a conversation with Alana Steinhauer a couple weeks ago, and somehow she got connected with state epidemiology and they have a reporting system, but I believe that's for quasi-medical or medical facilities. And they came up again with Berkshire Meadows. They would like a way to report these rapid antigen tests, which I think they can use that system, but just for anybody, how do you do that? And Ruby had said that she talked to you and there's more information. So I just said I would follow up.
Oh, I don't remember that conversation,
Okay,
but
well,
I will say, I know
how
that
do you do
Northampton,
that?
so
For just
the
the
state
general
does not
public.
recommend that those who use the Maven epidemiology tracking system, the state does not recommend or encourage the users to be reporting self-reported test results. It's certainly possible, but it's not the information they're looking for or will do anything with. It goes in as a probable. It doesn't add to the data that goes into the official state reporting, for example. It really does nothing. I will say, I know that the town of Northampton has put out a solicitation to the community members to report their rapid antigen results. And I believe that they're using that just within their own health department.
And that's what the
to get an
conversation-
idea. I will say, I don't know that we have the bandwidth to really take in that information. However, I will acknowledge a huge frustration I have right now because of the lag in getting epi data about the current strains the time lag. I have no idea unless I talk to people what COVID looks like for them in our community. And currently I only know for children and people 65 and up, because that's the only ones we call. So I can see a benefit to having people reaching to us with information, because it's health information. I can't say, just shoot me an email. Now you're putting HIPAA information through an insecure server. I can't say, give me a call, leave a voicemail. I do not have time to listen to all those voicemails. I don't really have an answer right now.
Well, that's
But
what
there's a need though, I think, even if it's not gonna give us, I wouldn't rely on it giving us useful numbers necessarily, because it's gonna be a biased group of people who are motivated to report. But I would just love to know what COVID looks like to our average community members right now. I don't even know that there's so little being reported because the surveillance has gone out the window. It's really frustrating. So we're looking at UK data, we're looking at Denmark data, South Africa data. I don't know what's happening in our community.
That might be an interesting conversation to have with DPH, because they do have the thing on the phone that you can report that you tested positive.
Oh, the Apple thing or?
Mhm.
Oh, right.
There might be
That's
a way.
That's for tracking exposure.
It is.
Yeah.
But I wonder if that could be used, like accessed by communities to see how many reports have been in a community that, like, and then you could push that. I mean, it would be an interesting conversation to have with.
I know. I think the uptake of that program has been minuscule,
Because
unfortunately.
it's a privacy issue. I
It's
think.
privacy also, they rolled it out to Apple only, and there actually is, anyway, yeah, it's an issue.
I think we need, we're gonna I'll end this by 10:30, I
Yeah,
hope.
we're gonna move quick, so
Yeah.
I'll quickly answer that. It's only me speaking. I wouldn't put like emails onto a website. However, we have the quarterly report that we gotta kind of look through and get feedback on, FAQs, like documents that we think can go on a collaborative letterhead. I think those are more relevant to websites rather than emails, because I don't know about you, but I get a lot of crazy emails. And you put like things with emails on, you start to get this crazy kind of stuff. If we can convert certain data that Dr. Chang feels relevant, let's work together, maybe we get that kind of like
I'm
FAQs,
thinking FAQ things.
things like that. So let's have that conversation, figure that out. I wouldn't want to put like emails into a PDF on the website.
Amy, but I mean, because things are changing
Yeah,
day by
yeah,
day,
yeah.
and the dashboard reflects those changes,
Yeah,
and it's
yeah.
probably the most simple way of doing that. But
Yeah,
yeah, I just think Dr. Chang and the rest of the board are really pleased with the recommendations that Amy passes
Oh,
along,
yeah,
and
great,
and
yeah.
finds that the greater community.
I
although,
think they are on a lot of
They-
community listservs and email groups. Like I know a big batch goes out in Monterey. I know Alford sends it out. I mean, some groups are doing that.
Berkshire Edge posts it every
Berkshire Edge
week.
posts it. I know there's a couple different email listservs for Great Barrington. Maybe if someone wants to pick it up,
See,
they're
that's,
welcome
that's
to.
another thing about use though, is something like the Berkshire Edge has the facility to take your report and get it out to a really lot of people. Honestly, as you said, we don't have the
No, it's
bandwidth
a lot.
to take it in and get it out. I mean, if I'm lucky, if I can update a website once a week,
Right.
so we can't.
Yeah, well, the second piece, I'm losing my
The
train.
second piece is that I've been hanging on to
Oh, yes.
COVID
Yeah, we'll
antigen
get all
tests,
that
and
on
I
the way
want to
out.
get them out
Yeah.
because I think the expiration date is like coming up.
Yeah,
And I was hanging on to them thinking that we would use this structure to do COVID clinics, or pop-up clinics, but I like the idea better of just handing them out.
oh, the
Yeah,
pop-up
and we
clinics.
also
Yeah.
have the batch
Yeah.
test.
I
kits
did
already.
notify the media on by appointment only,
Okay.
and Amy and I did a comprehensive interview with Clarence. I think he's covering a lot of the town meeting things. That should be,
Yeah.
that's all that is in that interview, and it should be going to the Eagle any minute now.
Okay.
So that's where we're at
Is there
there.
table discussion about reporting of antigen tests and how to do that? Or just not? Are we just gonna leave it?
Yeah, I don't know
and
the answer
kind of
to that.
Recognize that it's unfortunate, but that's the way that we're moving.
Maybe we'll like put it in the mental parking lot, and if we
Okay.
come across something like that seems,
Yeah.
because we've been thinking of things like, and then it comes up the next week, just like the entire COVID.
DPH
thing.
could be working on it, right? I mean, who knows? I'm sure if I'm frustrated about data, they are super frustrated on data. So who knows
I guess my
what's going
last
on.
piece, I don't know who would want to reach out to, maybe Laura, but they got that huge contact tracing grant for majority of the county. And I had thought they hired a full-time epi.
I think.
So,
they-
and I don't know if
Yeah.
that
That's
person is
Maria,
doing
wasn't it
kind of,
Maria?
no, this
Someone
Jen,
from
Jen
VHS,
somebody.
Yeah.
She used to work at VHS, but I thought she was doing epi stuff for the entire county, and maybe she has some more.
You know, I didn't need to reach out to her anyway, so I'll just make a note to shoot her. an email.
In my last piece said, you know, the quarterly report is not on the agenda, but it's really meant for the collaborative members to take a look at, provide feedback, because we want to go live with this, especially when we're getting ready to present to the select board next week. We want to be able to, well, not next week, week after, to take a look at this feedback and maybe work with Amy, Jill, and Jane on this. I will say very briefly, we're gonna try to keep this as a quarterly comprehensive report. And I know we're doing stuff with Sheffield, but it's really hard administratively to break all this out separately by town. It's just, we don't have a lot of administrative bandwidth to do that. And it's just, I think it makes more sense as a collaborative for everyone to see what's going on in the surrounding towns. But if you can just take a look at this, it's a first iteration and it will evolve over time. And just provide us feedback if this makes sense to you, and if you know, if you have thoughts and ideas for the future. But for now, this is what we're gonna present.
Great.
That's all I have.
Does everybody have that report?
Yep.
Okay, great. Thank you very much, Amy. Yeah, well, I think we often sort of leave things hanging, and I'm sorry, but it's hard to close everything down. Grant discussion updates quickly, one line each, sort of.
Jill, any updates on the car seat program?
I submitted for 2 grants. I got, the first one was a Buckle Up for Life through the state. I got that. There'll be over 50 different varieties of car seats we'll be getting as soon as the vendor is secured through the state. And I haven't heard about the Toyota one yet.
So just so everyone knows, we're going to be working on, so Jill got is a certified tech now to do car seat installations for the collaborative, because that was an identified need. And so we're slowly launching that. And Jill, and I think Jane, and with help with Amy and others, wrote a couple grants to get a bunch of free car seats. So stay tuned for that.
Great, health equity.
That was my update about the masks.
Ah,
That is
got
that
it.
grant.
Okay. RC profile. what
Yeah.
is that one? On the
So-
rover code.
So this is one, they came up quickly and we were asked to be a partner on a grant. It represented a low amount, but I will say that we were open to it and it happened really quickly. And in hindsight, I realized I should have taken a step back and really engage the collaborative. So I just,
What is it?
it's basically to engage more on the opioids. It gives a little bit of, it buys me a little bit of time, because I'm only a small amount of administrative for the actual collaborative. And then there's other things. And I think sometimes those lines get blurred, like what is for the collaborative, what is for Tri-Town, and it just happens really quickly.
So Railroad Street reached out, they were writing a grant, they had to select 5 partnerships, but in hindsight, we should have just sent an email out to the leadership and said, hey, are you guys good with this? It's just, it's something we'll do better at.
Thank you very much for that. Program updates, IMA.
95% complete. We're working with Rebecca to present to the select board. Actually, Ellie gets the prize. She was the first one. So we're all done. We're going to meet with Rebecca in the Great Barrington Select Board on the 23rd. I'll connect with you on thinking about how to strategically do that, but just kind of high level. Here's the grant. I'm gonna make a bunch of copies for you next week. I'll probably connect you maybe Monday. Give out the quarterly report, talk about what we're doing short term, what we're doing long term, and that
We don't need to recite the strategy.
So that's where we're at.
Okay.
Great Barrington, we're done.
Good. Shared folder update. Is that something we
can
Yeah.
skip over.
Table? Yeah, okay. Sharps collection. We know that's happening with the van, the harm reduction van.
Yep, and then we're
And we have
working.
not gotten any update on when they're coming to Mount Washington, by the way.
They're not great with communication right now, so I can help facilitate that. So Sharps collection, Alfred is gonna be purchasing one. There's actually money to purchase the kiosks and any of the towns that wanna do it. Talked to Great Barrington, possibly doing it, did find a vendor, and might also approach Tri-Town to see if maybe we could have one as well. So that will be 3 more places in addition to Sheffield, who's been hanging in there all along. So once we get a network, it will be exciting to be able to kind of put that out.
And Great Barrington, you mean the police department? Or who in Great Barrington? Or
Just
where in
you.
Great Barrington? Oh,
Yeah,
okay.
we've talked about that Great Barrington might be interested in
Oh,
doing it,
okay.
and we're
Yeah.
just pursuing it. But there may be funding available if you know, if we don't have, if the town doesn't have the funding to buy a kiosk or have access to a kiosk through Railroad Street, there might be funding to purchase a kiosk.
We have funding.
Is there also the issue, I understand locally, about emptying that and recycling those? That you have to pay somebody to come and collect them. Is that a role that the van could do? Yes, it is.
It is. So they would collect what they have, what they're bringing in. That would be a question for them, whether they'd be willing to take, there's like transportation issues. So once it gets dropped off and it goes into the box,
Right.
then there's certain protocols and training that's needed. So that's a good question. They're happy to accept them when they're there.
I understand that.
But I'm not sure if they would be willing to take like our big box. It's
Right.
not a completely cost prohibitive thing. And I've been working with a couple vendors. One seems a little bit more easy to work with than the other.
Okay, I just remember that there's a fee and having to have somebody pick this stuff up. And it's occurred to me, if that's happening already, could we consolidate it somehow?
They asked us if they could give us their needles. And I was like, I don't think that's gonna work.
Right, okay, great. URL options.
Oh, so I put this on the agenda, just thinking about the collaborative, and I meant to print out a list of some of the available ones. But you know, like, is the group interested in having like a phantom, so it would be like Southern Berkshire PH, right? And then it would link to our existing website, for branding purposes. So that's something that maybe at the next meeting, I can bring some different.
Right, okay. Community partner updates. We partner wherever we can. Got it, okay. Upcoming events, Jane, these are.
Yeah, so we, the Choke Saver course, actually, the 16 was canceled. We've pretty much gone through who we, you know, we've done 2 months of these, and we're not getting new people coming in. So we're gonna discontinue them. I think that we might in the future be able to provide them. We'll see what that
Maybe
looks like.
quarterly or something. Do them quarterly,
Yeah.
weekly or whatever.
Yeah, and the reason why I pointed to you is like, then we'll discuss whether we want to continue to use David or if we have
get us trained.
capacity eventually. And then the other thing I wanted to, all of the boards of health should think about, like, Rebecca, did you get that email that said that camps are gonna be able to have access to? Okay, I wasn't sure how broad that went out, so that was exciting.
I
as
got
well.
it too. I think it went up pretty broadly.
Good.
Yeah, that's awesome.
Good.
Do you think the camps are getting it? That's what I didn't know if they
No.
were registered with the
The
state.
camps are not getting. it,
No.
because I
Okay, so,
asked.
so we all need to be reaching out to all the camps.
Right.
are
I thought the email said that
in our
they sent information to the camps.
Yeah, it kind of seemed like it, but I wasn't sure. It could be one of those
Well,
things where not all get included.
Basically, this
and
is
wasn't
what,
heard.
this is what was communicated to the camp network.
So all I know is that the camp people that have been asking me for stuff did not get it.
Okay, right, got it.
So there's
Right,
just
but they're
a
doing
sample of
their
3.
training as part of their training for their counselors and everything.
Well, but they
Right,
need to know
so-
that it exists.
Right, they need to know that it exists, but the thing is that the dates that we're
timing is-
looking at is
yeah.
not helping them because they don't get their staff until the week before.
Okay.
Yeah, so the email says, please see the following message sent to the recreational camp and program stakeholders across the state.
Right,
So barely they got it.
theoretically, they got it.
My guess is, since they'll have to have a camp nurse, that's gonna be the person doing it. It's actually a 20-minute online training. It's not a big deal. And then it's it looks like it's following the same program that we. for
Right,
ones
it's
we
just the
get.
timing of it that has to be.
Yeah,
broken
it's
up.
unfortunate, but a lot of those nurses may have already gone through it for if they work at schools, for example. So I think it's probably gonna be okay. But we're here to support those. So that's another thing to know. If anyone's asking for questions around that, we can help Phil and I.
Okay, before we set the next meeting agenda, we need to talk about that subcommittee and figure out who might be members of it. I think have the whole group would be a bit much. We'd want to come back and present to the whole group. Are people who are particularly interested in it and would like to participate? Those of you who are online, et cetera, as well.
If we can do it by Zoom, I
Oh, yeah,
I
yeah,
can
yeah,
do
that's no
that.
problem.
Yeah,
I would like to be on it.
So the subcommittee is making a recommendation to this group.
Correct.
right.
And then how does that recommendation get to select boards?
That would be part of the plan.
That would be part of the plan that the collaborative works on
Yes.
together?
Yeah, I think so.
Okay, all right, and not the subcommittee.
I think the
Well,
subcommittee
subcommittee-
should pull it together, present.
And then have a critique, but how one would move it forward would be part of what the subcommittee would do, but it would come back here for discussion and agreement.
And then finally get voted on by the whole group
Yeah.
to, as a presentation.
I didn't want to ask this before our vote because I think we needed to make that vote regardless, but I don't want to do all of this work if the select boards could just say, screw you guys,
Well,
we
they-
want to do whatever we want to do.
Well,
That's
they
that's
can.
a, that's
They
a,
always
that's a
can.
risk,
Yeah.
that's a risk.
But they have to do it publicly on the record, right? So,
Right.
I mean, frankly, they're
Yeah.
accountable to their community. So
Well,
to
and-
that end, I would like to participate from the place of monitoring evaluation expertise. I would like to offer that to the group. And I, if we are strongly considering the plan of supporting rural recovery, I would see if Gary could be part of that, because I would very much want to know more about the capacity within the group.
Yeah, we're trying to
currently.
figure out from the internal group first and figure
Oh,
out
yeah.
Gary and maybe
Same.
others.
What I can see happening, like how I see the next month playing out is that the money is gonna either start coming in or they're gonna get notified more officially that it's coming. So just having a plan, I think we're not gonna probably see, we're gonna see a county-wide discussion about it. And I think that the work of the subgroup is like, is whether it's rural recovery or other things, like I feel like South County just needs to be prepared to advocate for making sure that it doesn't just get put into the abyss of like institutionalized, that there's not going to be a measurable impact on the people that have been affected from the opioid crisis. So like, I feel like so there is a little bit of timely part of this, and it could be part of the bigger conversation. So like, we might have in our minds right now what it might look like in South County, but then once we talk about as a full county, maybe it fits in a different way, but at least South County has a voice saying like, we would like to make sure that these needs are met. And we would like for this is an identified way, so. Yeah.
So we have Pat, let's try to wrap this up. Pat, Ellie, I guess I put myself down, that's 3. We would probably need at least one more to not have a quorum problem. Rebecca,
I mean, I would really love to be part of that conversation, but I'm sure Jane does too, because she's
Yeah.
very tied into, the monetary aspect of this, and I don't want to exclude anybody, but I also don't want to make the group too big.
So
But I would love to participate.
Here's my thought on it is I might be a little bit too close to it. Do you know what I mean? Like, I don't have any financial gain, everything, but I feel like it's important that it comes from the community towns, and maybe because I'm involved in like building this up, I might be too close to it to be part.
yeah.
You certainly would be part of the conversation.
Oh, no, yeah, as the full collaborative conversation, I think.
One of the things that I see this happening, and I think I might be able to address this, Rebecca, is that this also touches on the relationship between the Board of Health and the Select Board, and it's talk about a situation that nobody wants to talk about. That's a tough one. So I think that's what you're sensing. I think having the collaborative come up with ways of presenting this might go a fair distance to helping us along that road. That's at least that's the way I.
Well, we gotta start somewhere, though.
Yeah, and this is a good place to start.
Yeah.
What I'm sensing is, we're all on the same page with working collaboratively, but I don't know that select boards would be, so that's.
And they're not.
Yeah.
Lee's already having conversations, Lennox is having, I think, and I don't want to spend months on this. I think we should get together high level concepts, maybe put it
And have it
together
ready for the next meeting.
for the
or
next
something.
meeting and say, here's where we're at, and then we can fine tune it. I'm concerned just like you are. I mean, I'm gonna have to present this to Lee, Lennox and Stockbridge separately.
Right.
And I have no idea what they're thinking. They probably don't even know.
Right, and from my standpoint, my select board would probably be very supportive of this. Where we're gonna have the issue is with constituency and putting pressure on the select boards. What we need to do is support the select boards and say to them, look, this is a really good way for you to answer a lot of these questions.
Yeah,
Because-
yeah, I don't think it's gonna be
So-
as hard as you think, because the money, when they look at it realistically, except for buying Narcan and storing it in the closet, there's very little you can do independently. with
Yeah.
a
Right,
few
and this has to go
$100
to
a year.
finance committees rather than select boards. I think that's another very.
Yeah,
important-
okay.
I mean, I think we should worry about
We've got-
that later.
Yeah, I think we've got the group. I would like to do one other thing, to figure out a chair, and perhaps that could be Ellie. Yeah,
Oh, of this committee.
of the subcommittee.
Oh, okay, God, you just scared me to death.
Okay, okay.
All right, good, Ellie.
Okay, good.
Great.
Thank you all very much. Do we need a motion to this membership? We've got a motion to form the committee.
The next meeting.
Oh, we already did that. Well,
Yeah.
I think, well, I mean,
Do we need a vote? I don't think. we need a vote.
I don't know. You could if you want. Right now, we have 3 people. Ellie, Pat, and me.
Right. Well,
Unless Rebecca wants to jump in.
In what?
The little subcommittee.
I definitely.
All right, so
do,
4 of
yes.
us.
Okay, so there's 4.
Well, yeah,
Well,
yeah,
I'm
Amy's
not
staff.
part
So
of the-
Right.
we have to keep less than 5
Oh,
membership
right.
town,
Right.
voting towns.
Right. So that's 4.
Yeah,
Okay.
So I have a motion to accept the subcommittee.
A second motion.
second.
All those in favor, any discussion? All those in favor?
Aye.
Yes.
Aye.
Any opposed?
Okay, the next meeting is June 10th.
Well, okay, so I scheduled something else for June 10th, and that's probably more movable than this meeting, but I just want to.
So then we can coordinate location. We meet in Great Barrington every month. We can meet in another location if there's a conflict. It was
Well-
convenient in Great Barrington, but
I could see if I can move this other event. I planned out healthcare for June
Yeah,
10th, forgetting that this meeting
Yeah.
was that day.
I can move it to
so-
Lee if people are okay with driving to Lee or Sheffield or anywhere else. But just, you gotta let me know like in the next couple of weeks, so we know going into the posting for
Okay.
next meeting where it's gonna be.
Well, let's just do that then. I mean, I can attend from Zoom, so I can get 2 places at once. So let's just, if you wouldn't mind having a hub somewhere else.
Oh, no,
and we can keep it on June 10th.
yeah,
Okay.
we decided early on to keep it, it's more of a, from south and where we are, is like kind of easier.
We can, in July, we can move back to Great Barrington unless you like it.
Well, yeah,
Like
well, we
meeting.
were talking about possibly going to every other month at some point
Right,
after the
right,
IMA.
Right, but I think we've got enough on our plate. We don't want to do that yet.
All
Okay,
right.
is there a motion to adjourn?
So moved.
Second,
Second,
anybody not in favor? All right, thank you all.
thanks,
very much.
everyone. Have a great weekend.
You too.